I'm Dr. Girish NS. I'm a consultant nephrologist in Columbia Hospital's Hebbal branch. Chronic kidney disease, diet, nutrition and fluid. It's an important topic of discussion and there are lots of questions with this regards in many of the patients' mind. What I would say is the diet and the fluid restriction in chronic kidney disease has to be tailored according to the individual patient. For example, certain patients with early chronic disease, let's say stage 1 and 2, they don't have to have a strict fluid restriction or certain types of restrictions imposed upon them. Whereas stages 4 and 5 of chronic kidney diseases may need a much more stricter diet and fluid management. But there are certain principles behind this dietary management. First is a low salt diet is invariably helpful for chronic kidney disease. Second is a diet that is focused at managing the underlying cause. For example, in diabetics, a low carbohydrate diet. In somebody with heart disease, a low cholesterol diet might be helpful in modifying the risk factors. Low protein diet is one question I get asked all the time. Sir, there is chronic kidney disease, should I stop eating proteins? And the answer is no. If you have chronic kidney disease and if you are a vegetarian, then majority of the vegetarian proteins have been proven to be safe in such conditions. It is certain types of animal proteins such as red meat, such as mutton, beef, pork, consumed in excess may have to be avoided. So my advice is, if you have any doubts about your diet and fluid restriction, better to consult your doctor or nephrologist for tailoring your diet as per the need of your disease.